Hi there. My name is Sarah and welcome to this video series. I'm going to be documenting my journey as I go through some health challenges and hopefully healing along the way related to connective tissue and midline disorders that I have. Connective tissue being the fascia system, the facial tissue in our body that starts beneath our tongue and travels down the length of our body, through our hips, down into our feet, and is like a big spider web that holds our muscles and organs in place. The connective tissue is one connected organ in our body, and so something happening in one spot is going to affect the connective tissue in other spots. I've decided to do this series because of the many struggles I've had. I'm 40 years old, and the journey I've been on has been very enlightening, and I want to share my story for other people to hopefully benefit from and understand a bit more about their own struggles and possible ways to heal some of these conditions without surgery. Well, without major surgery. So first and foremost, the biggest piece of my journey right now is my tongue tie journey. I was diagnosed a few weeks ago, 40 years old, with a class 3 tongue tie. A class 3 tongue tie means that the tie is visible to the eye, but it does not come to the tip of my tongue. It's beneath the tongue. Class 4 would be a tie in which the frenulum, the string, is attached all the way to the tip of the tongue, making it very difficult to move your mouth. And most babies that are caught early in life have this type of tie. Mine is only midway up to my tongue, so it means I have some mobility and function in my tongue, and therefore it was harder to catch or to be aware of that it was there. A posterior tie is another type of tongue tie in which it's less of the frenulum and the string, while it's there, but it's covered by more of a muscle-looking thick band of tissue. It's less easy to see. It's even harder to diagnose because of that. And actually, that's how I started my journey in April of this year. A few months ago, my 5-month-old son was diagnosed with a posterior tongue tie after 5 months of absolute torture trying to understand what was going on with myself and him. So I'm going to start there with just the symptoms that I experienced with my son, and then I'm going to move on to the lifelong problems and struggles that I have had with regards to my tongue tie that in fact I had no idea had anything to do with my tongue tie until very recently. So my son, very, very classic tongue tie symptoms, but in the medical world, still not recognized, and definitely was not caught in the hospital, and was not caught through the many doctors I saw, the lactation consultant that I saw. Finally was caught by a pediatric chiropractor who didn't like how his tongue was moving in his mouth. But in reality, when you dig into tongue tie, my son was a classic case of tongue tie. He had nursing issues. I had milk production issues. I had painful nursing. He had digestion issues. He had colic. He had reflux. He had spit up. He had gassiness. He had ended up having torticollis and difficulties with the left side of his body, the left side of his neck. Couldn't do tummy time. Couldn't turn his head. Just so you know, that can and is also related to tongue tie. He had issues weight gain, 3rd percentile, still at 9 months old. My son is in the 3rd percentile for weight. He's in the 50th percentile for length, so he's long and he's very, very skinny. Has had difficulty getting on solids, difficulty with sucking, difficulty with a pacifier, difficulty with a bottle. He's gagging, spitting up, puking, constipation, high arched palate, does not move his tongue when his mouth is open. Still to this day, it is planted at the bottom of his mouth like I just showed you, instead of like this. You don't see that happening in my son's mouth. So I've had a host of issues with him. It was absolutely exhausting, feeding every 2 hours, round the clock, because he was sucking in so much air that it was making him feel full, and then his tummy would be upset and he would wake up starving again 2 hours later. This went on for months. Being dismissed, told it's normal, told it's colic, told go home. Finally see a pediatric chiropractor and begin the path of healing for him in the world of dentistry. The medical world was of no help to me. I found my way through dentists, pediatric dentists, eventually myofunctional therapists, osteopaths, chiropractors, craniosacral therapists, all words I barely knew anything about when this all started, less than a year ago. So in that process, my son had his tongue tie released, lip tie as well, on May 4th. It is now the end of August of 2021. And he has been on a very slow road to recovery. He had a lot of fascia tissue issues. He had fascia down on his forehead that was really making it hard for him to hold up his head at 7 months old. He had asymmetry in his body, one leg appearing longer than the other. He had issues with his stomach and digesting food, which he's still working through. Issues with tongue mobility, he's still working through. And so upon the release of his tongue tie, first thing I was told was that it's usually found in one or both parents, that it's a genetic condition. I was told this by a dentist. Initially, I thought it was my husband. My husband had speech issues as a child. My husband had some crowding in his teeth, and they removed several teeth from him when he was growing up. My husband sometimes has difficulty pronouncing certain words. He has some, I'm going to call it some asymmetrical movements, and maybe he has some dyslexic type tendencies, which if you dig into the central nervous system and the midline conditions, ADHD and other central nervous system issues, you will find a connection, relation, and tie to those as well in regards to these midline disorders that I'm referencing today. Anyway, thought it was him. And then one day, it just sort of dawned on me. It was almost like a light bulb turned on, and I suddenly realized, wait a second, it's me. Me too, or just me? I wasn't sure at the time. At this point, my husband hasn't been officially diagnosed. I have. And that was about a month after my son's release that I started to really realize that I had some very odd lifelong symptoms that the more I dug into tongue tie, realized actually put me at high risk for having one. The first being that it's genetic, and usually one or both parents have it if you have a child diagnosed with it. And it's often the beginning of the journey for many people, because in the 1940s, they used to routinely cut the tongue tie at the hospital. And as breastfeeding habits went down and bottle feeding went up, tongue tie was somewhere lost in the shuffle and became a parent issue and not a real condition by the medical world. But I'm hoping in my lifetime that changes, and the true significance and mind-blowing effects that tongue tie can have on us in our lives will hopefully come to light. And that's another reason why I'm sharing this video series, to help bring this very misunderstood condition to light. So let's talk about my symptoms, shall we? Listening to this, honestly, it sounds crazy that any of these things could be connected to a tongue. But what I have learned about the tongue is that the tongue is the starting point in the body of the facial system, the structure of the connective tissue that connects to the rest of our body. And so you're going to hear in my story how my tongue has pulled on and distorted, deformed, harmed my body all the way through without me knowing it. Okay, so we're going to start at the top of my head. So I have facial asymmetry. My left eye does not open as wide as my right eye. My nose veers to the left. I've actually had it surgically corrected at age 17 and was told that I had broken it but didn't remember. In fact, it was a deviated septum from my mouth breathing, which I do because of my tongue tie, and that resulted in an undeveloped airway. I have a high palate as well from my tongue resting at the bottom of my mouth instead of at the top of my mouth where it belongs. I also have tongue thrust, which means your tongue is supposed to rest on the ridge behind your teeth. It's not supposed to touch your teeth, and it's supposed to rest at the top of your mouth. Mine rests in the middle and forward, so it's touching my teeth. Caused some, after having orthodontics, it has actually caused one of my front teeth to be pushed forward a bit because of the way my tongue thrusts forward. I had surgery on this tooth because it never did come down, again because of dysfunction in the way my tongue was sitting in my mouth. And what else can I tell you? So this is because also in my case, my tongue pulls to the left, and I'm going to show you I'm going to show you my tongue tie so you can understand this a bit better. So you'll also notice that my jaw is slanted. Okay, so my issues have been primarily left side, pulled, weakness, facial connective tissue issues on the left side of my body because my tongue tie actually is slanted to the left. So we're going to take a look at my jaw and my tongue. Do you see the slant? Going that way. My tongue tie that tissue, I've seen it my whole life, never knew that little string is not supposed to be there. I will grab my daughter perhaps in my next video series and have you look at her tongue, which is healthy and normal, and in fact there is no string at all. Okay, it's just clean, straight tongue. Now, like I said, a class 4 tongue tie is when that string literally comes to the tip. So, on with my symptoms. The other things that I have had over the years is jaw pain, facial pain, clicking in my jaw, TMJ. I've had night terrors because of the flight or fight mode, sleep issues with onset of sleep, staying asleep, insomnia. I don't have sleep apnea to my knowledge, but I am being tested for that. But breathing issues, difficulty getting a full breath from mouth breathing, from not breathing through my nose, get sore throats easily, had ear infections as a child because all of the connection between the tongue and those different parts of our body. And the fight or flight mode, the night terrors, is that my body is afraid to fall asleep because it's terrified that I'm going to stop breathing and die. And so it wakes me up, and I wake up 40 years old. I've had night terrors my whole life, anxiety, because the nerve system, I think it's called the vascular nerve, that the tongue is meant to soothe at the top of the mouth, the roof of the mouth. If the tongue isn't spending enough time there, we're not learning to self-regulate and self-soothe, and makes us feel very anxious all the time. Pain in the left side of my neck, pain in my shoulders, travels over to the right side of my neck, travels over to the right side of my shoulders, torticollis in my neck, dry neck, kinked neck. 20 years at the chiropractor, since I was 17 years old. To this day, I've had a chiropractor tell me that that's due to phones and having my head turned down, looking at my phone, when in fact my pain started long before cell phones were even around. I have the beginning of Dowhinger's hump, I think it's called, where your neck is pulled forward. I have poor posture. My head is like there's a 16-pound bowling ball on my neck instead of like the 3 pounds it's supposed to weigh because of the way my head is pulled forward. Hip pain. Following the birth of my children, I developed hip pain. And with that, following the birth of my second child, I have discovered that I have prolapse pelvic health issues, which is going to be another video series on the connection between the connective tissue that holds up our pelvic organs and our pelvic health, our pelvic tissues, is the same connective tissue that starts beneath our tongue. So if we have a tongue tie, we are at risk of having other connective tissue disorders, and pelvic health issues. Prolapse issues are related to pelvic health. But guess what? You can heal them. All of this is healable, okay? I'm working on this healing journey, and I can't wait to share you some of the healing things I've discovered along the way. Onwards with my pain, the pain radiates down into my feet. I've had bunions since I was 17 years old. Let's see if I covered everything, okay? Quickly. I was slow to speak. I was a thumb sucker. I have a very strangely shaped head. It is not round. And I wake up tired, not feeling rested at all. Go to the bathroom a million times a day, constantly fatigued, need melatonin every single night, drool at night sometimes, bite my cheek, constantly have cuts on the inside of my mouth from biting my cheek. I think that's the majority of it, folks. So yeah, I just want to start with that, and then I'm going to share some of the successes that I've had in the 1 week that I've been doing myofunctional therapy next, in my next video. So stay tuned. It's exciting stuff. I've had some amazing results in less than a week. I can't wait. I'm on the road to healing my tongue tie and my pelvic health issues as well. So this is a bit of a combined video series towards looking at both of those issues and how they're connected. Also on the agenda for me is looking into healing my feet once I have my connective tissue roots, starting in my tongue fixed and my pelvic health, my pelvis corrected. Then I'm going to be moving on to restoring health to my feet. So stay tuned for that. And I'll be back with some great updates on the successes I've been having so far with the myofunctional therapy that I started a week ago, leading up to the actual release date for my tongue tie. Thanks.